What's up guys? In this video, I'm going to talk to you about some of the worst cases that I've seen as a practicing psychiatrist. I'm Dr. Anthony Collada. I'm a board certified psychiatrist. And right now I'm speaking with you in my office setting in my clinic, but this is not where these patients typically present. I've typically seen these patients in a hospital setting where they've been really ill and sick, and it takes often a variety of providers to try to help them with their disease. And the first patient that comes to mind, and grant you all these are patients I've seen years ago, and you'll also notice there's a common theme with all these types of patients, and the common theme is substance abuse. So one, there could be the disease itself, but when you add drugs on top of it, it can just make things so much more complicated and more difficult to treat. On the other hand, sometimes it's the drug use that caused the mental disease. One case that comes to mind is a person in his early 20s who is suffering from heart failure. That's right, someone in their early 20s suffering from heart failure, and the heart failure was from a lot of intense and frequent methamphetamine abuse. Methamphetamine is a drug which people use to get high, and it can damage the heart over time, and it also damage the brain over time. And so this guy unfortunately used so much of this drug that it caused heart failure. He had some brain damage. He was basically not able to control himself, and it caused a lot of headache and problems in the hospital setting. Also, the heart was so impaired that he couldn't pump enough blood in the body, and the kidneys started failing. So the kidneys need a certain amount of blood or perfusion that the heart pumps to, and because there wasn't enough strength in the heart, the kidneys were dying, and so this person just had heart failure, had kidney failure. He couldn't really comprehend things because of the brain damage that the drugs used, and unfortunately in his early 20s he passed away from a complication of these symptoms. Another person that comes into mind is also in their 20s, but their problem was a different drug. Their problem was alcohol. And so they continued to drink alcohol despite the consequences that it was causing. And so alcohol can have a variety of consequences, which I talk about in previous videos, but this person's case, it caused them to vomit blood. And they're vomiting so much blood that they were getting anemic. They had to be in the hospital for blood transfusions to get procedures to stop the bleeding, but yet they couldn't stop drinking. And it's a condition called esophageal varices where people will vomit the blood, and it's really challenging to treat. Now, another case that come to mind, actually I saw them more in the psychiatric setting, but this is a guy with really no major mental health history, but what happened is he was using a drug called LSD, and LSD can be like a hallucinogen and can cause people to get psychotic symptoms. And so when this guy used LSD, he had a psychotic break, and he ended up jumping off a bridge and becoming paralyzed. Now, a lot of his mental faculties were still there, but that damage from that incident seemed to be permanent. Not only did he have chronic physical limitations for the rest of his life because of using that drug, because of that one episode, but also there's ongoing mental health challenges as a result from it. So basically it just took one episode of the drug where he snapped, and it really is leading to lifelong consequences for the rest of his life. Another case that I come across in the hospital setting was someone who was using a drug, fentanyl, and they're found unconscious in the community. We're not sure how long they became unconscious, but once they were found and brought to the hospital, they just weren't the same. So being unconscious, they didn't get enough oxygen into the brain, and so they have a condition called hypoxic brain damage, and basically they're so limited mentally now because of the lack of oxygen into the brain that they're basically very limited, able to communicate. They need people to take care of them, to feed for them. This person can't care for themselves anymore because they were just unconscious from drug overdose. Lastly, what I want to talk to you about is people who use IV drugs. Now, it's not just one case that comes to mind. In this case, I've seen several different types of it where people use drugs intravenously. Maybe it's something like heroin or something like that, and it causes infections maybe in their brain or in their heart. They can get things like endocarditis or bacterial infections in their heart. They can get these bacterial infections in their brain, and it's really complicated, difficult to treat. Whenever you have an organ failure or organ damage, it often affects the other organs just because the body sort of communicates in a very organized and synergistic fashion. Also can lead to other infections like Many of them will get HIV or hepatitis C, and hepatitis C can lead to liver failure and even liver cancer. HIV in itself can lead to other infections that people can get exposed to. So it really can just get very challenging to treat, very complicated. It's one of the most important reasons for mental health and also for physical health is for people to maintain sobriety, because when there is drug use and consequence of the drug use, it can get really difficult for providers to treat it. Now, these are just only the cases that I've seen. Unfortunately, there are so many cases where people actually have had committed suicide or have accidents where they've killed themselves or killed somebody else due to consequences of the drug use. And so really, it's just not worth it. There's other ways to help ease anxieties, help ease stress, help with people's quality of life besides drugs. Because of all these episodes were related to drug use, I just want to talk about some resources that can help with sobriety. And one of the most important is it has to come from within. People can't really force someone to be sober, but it needs to come from a desire from within to change. We often should probably start with prayer or just belief that it's going to need some amazing help or some help from God in order to be sober, or even to just cut back on the amount of substance being used. One of the premises of any AA or NA meetings, it often starts with a prayer and people being open about their weakness and that they need God or something greater than themselves to intervene to help them overcome these challenges. It often needs not only an AA or NA group, but a sort of supportive community in general. I know there's many church groups that can offer these supportive networks that can help. There are medications that can be effective for certain conditions, especially for alcohol, which can slow down the cravings for alcohol use or even decrease the high if someone wants to get high. There are some thoughts that medications may work on other substances, but these are still under research and hasn't really been definitively proven yet. And ultimately what it's going to involve is a behavior change. As you're stopping one habit or one pattern of behavior, you really need to replace it with a better, more healthier, constructive habit. Find whatever it is that you enjoy doing that's healthy, a passion, maybe it's a hobby or something that can benefit not only yourself but maybe those around you. These are just some of the cases that I've seen as a psychiatrist. I think it just shows the importance of trying to maintain sobriety. Everyone goes through challenges and difficulties and just trying to find healthy ways to deal with it. Thanks for watching.